Hello, my name's Ian McCall. I'm the organizer of the Australian Institute of Dermatology's Australian Dermatology Diploma. And what I'd like to do today is to just give you an introduction to the diploma, show you the websites that we use and tell you a little bit more about them. The diploma itself is run over 28 weeks, 2 semesters, each of 14 weeks. There are 7 modules in each semester, so a module lasts 2 weeks. We basically cover all the common skin conditions that you'll see in general practice. We have a particular emphasis on aspects of skin cancer and also cosmetic dermatology, because I appreciate that some of you doing this diploma are more involved in the cosmetic field. Nonetheless, you still need a good grounding in basic general practice dermatology, because those will be some of the conditions you're going to see. We emphasize diagnosis and treatment. If you can diagnose a skin disease, then the treatment's pretty straightforward, but the important thing is diagnosis. We don't spend a lot of time going into theoretical mechanisms. We do a little bit of histopathology because it is important. And we certainly do some aspects of surgery, but this is essentially a medical dermatology diploma. Now, one feature of the diploma is interactivity. You'll have a webinar every Wednesday night, every Thursday night it'll be this year, from 8 till 9 p.m. In this webinar, in the first week of each module, we go over some MCQ questions that you've done and go over the module content to make sure you've got an understanding of them, that there are no great difficulties. But in the second week webinar, we look at clinical cases that you submit. Let me go into the website and show you, because I think it's easier to do it that way. We use the My Skin Consult website. As you see, it's divided into a whole variety of sections here, but the course itself is delivered in this module section. We cover all the basic skin diseases. You can see we start off with an introduction where I'll go through a variety of mnemonics that will allow you to make a series of differential diagnoses for skin diseases with relative ease. If you've got this background, the whole essence is to give some differential diagnoses and then to look at the condition and work out what the correct diagnosis is. We also go on in Module 1 to look at topical therapy and topical steroids. We then go on and look at eczema and hand dermatitis, contact dermatitis, and also atopic dermatitis. Atopic dermatitis is going to be the commonest type of dermatitis you're going to see in both children and in adults. Then we look at acne, one of the other great conditions of dermatology, and rosacea, and some of the variants. In Module 4, we move on to psoriasis and the other papular squamous diseases, particularly pityriasis rosea, pityriasis versicolor. We even have a little chat about mycosis fungoides, which will present as a red scaly disease. Then we move on to the bacterial skin infections, particularly staph and strep, and some of the sexually transmitted bacterial infections. I don't see a lot of venereal disease. You might see a bit more in general practice than I will. But some of the people who do the course from overseas actually see a lot of sexually transmitted diseases, so it's worthwhile looking at them. And syphilis is still around. We then look at some of the sexually transmitted viral conditions and AIDS. AIDS is a big problem overseas. It's still a bit of a problem here, though, because of highly active antiretroviral therapy. We don't see the range of AIDS conditions that we used to see. But we also look, obviously, at warts, herpes simplex, and some of the other common viral infections and viral exanthems. We end off the first semester looking at both superficial fungal infections, including dermatophyte and yeast infections, and some of the deep fungal infections, and even mycobacteria and leishmaniasis. Now, leishmaniasis, all right, you're not going to see much of that here unless you're looking after some army people coming back from Iraq, because that's where they get it when they get bitten by the sandfly. But again, we've got overseas people taking this course in areas such as Pakistan and some parts of India. Leishmaniasis is a big problem. We also go on in the second semester to look at the viral and bacterial exanthems and drug eruptions, which are common. Usually your differential is the viral exanthem or the drug eruption, and we work through that. Some other pediatric skin diseases, and Module 9 is on infestation and bites. There's a little epidemic of bed bugs going around just now, and there's always scabies. The vesicular and bullous diseases looks at some of the immunobullous diseases, particularly bullous pemphigoid. And the connective tissue diseases, well, it's mainly lupus and dermatomyositis, though we do also chat a little bit about scleroderma. Now, you know, most practices will have 1 or 2 patients with these conditions, and if you're in a bigger practice, you'll get a chance, I'm sure, to see them. Urticaria and angioedema is looked at in Module 10 as well as some of the other hypersensitivity syndromes, erythema multiforme, erythema nodosum, and vasculitis, particularly Henoch-Schönlein vasculitis that occurs in children with some renal problems. Light-related diseases, big issue here in Australia, polymorphous light eruption, some of the porphyrias. Then disorders of pigmentation, particularly of relevance to people doing this from a cosmetic background. We'll look at lasers and their treatment here too. Then we, of course, go on to some of the benign and malignant skin tumors, the BCCs, the SCCs. And in Module 12, we take a long look at nevi and malignant melanoma. We also have a quick look at vascular tumors and malformations in children. There's still some common things dealt with in Semester 2. There's the hair disease and nail diseases. And we put one in this year also on oral diseases, because the inside of the mouth can tell you a lot about what's happening to the rest of the body. And we end up with a thing on cutaneous manifestations of internal disease, the things you see with diabetes and other disorders, renal failure and liver failure, and the skin problems that you can see also with thyroid. And there's a last little section on dermatological surgical procedures and cosmetic dermatology. However, these are also talked about during the course itself. And there's a particular emphasis in the course to skin diseases of relevance to people who are mainly involved in skin cancer work, because there are some skin disorders that you can easily mistake for skin cancers. And it's a feather in your cap if you can pick these up early. So these are the various modules. Within the site, there's also a clinical meeting section, and this will be where you'll in fact submit your cases. Each semester you have to put up 5 cases from your rooms. You can see we've got up to 1,000 odd cases in there when we've been running the diploma in the last 2 years. It's very easy to in fact submit a case. We comment on that case. So it's worthwhile to look at other people's comments and the cases that they've in fact put up. There's often a lot more detail than that in the comments. There's an image diagnosis section because each module has various image diagnosis with it. These are additional teaching material for that particular module. For instance, now let's look at the second one. I think it's probably more interesting. You can click on this to see the image in full size. Red plaque on the face, bit of scale. You put your, describe the lesion, what diagnostic category does it come into. Put your diagnosis in, it's discoid lupus. Then press submit. It'll tell you a little bit about the condition. It may give you a link to some other case. We also run Global Skin Atlas, and we'll sometimes relate to that. So you can then click on that. It'll take you to the atlas, and you can get a bit more information. So it's just additional ways in which we help to educate you about the topic that you're dealing with in that module. There are various other sections. There's rollovers. These are just another teaching method. We'll go through that in the weekend meeting. There's a big presentation section where there's a variety of PowerPoint presentations, and there's also quite a few Word and PDF presentations as well that relate to areas within the course. There's a self-test section where you can test yourself against a variety of random images that will come up. There's the teleconference area. Now, as I say, 2 teleconferences for each module. The MCQ questions we look at for Module 1 and content, and the cases that we get you to do for each module we look at in Module 2. Those cases are in the resources section. If we go down to, say, the cases for Module 1, if we're assessing that, the image is all enlarged when you click on them. And then you'll be asked a few questions about the particular image. You put your response in this area here, and once you've done the 5 images, you just press submit at the bottom, and it's automatically sent to me into a section where I get a chance to look at it and mark it for you and give you your grade back. So we look at each, we get you to go to do cases like this for each module. It's important that we give you feedback, and that we keep on top of the work that has to be done for the course. You really have to set somewhere between 6 and 8 hours a week aside to do this course, to do it properly. We use Habib's book, Clinical Dermatology, as our text, but we mainly use it for the images. It's got some fabulous images in it. It's a well-written book, but all the content that you need will be available in the various modules here online. And really, it's only a case of using the book to give you additional images and some additional information that you want. Each module, by the way, has a podcast associated with it when you start off, and that podcast lasts for roughly about 30 minutes. You just have a listen to it. It goes through the module and discusses some of the images and the like that are there, so it gives you an idea of what you have to learn. There's also often a few links to DermNet. It's a good source for additional information on a particular topic. And the links at the end of each module here are to some of the MCQ questions you have to do and the resource questions that you have to do. So I think you'll find the presentation of the course quite interesting. In the second week, by the way, we also use a blog. We put up some cases each day. You are able to go into them and make some comments. For instance, these were the ones for Module 14. If you're going to make a comment, you simply go in to the comment section, just click on the jump to comment form and put your comment in here, press publish, and it will be published at the end of the other comments. During the day, I'll often come in and comment on what you've commented on and perhaps ask a question or two. But at the end of the day, I also put up a podcast for the cases. And this podcast lasts maybe about 20 minutes, in which I discuss the cases and the treatment. So there's always a little bit there for you to listen to. It all adds up to improving the education that you're going to get, the exposure to cases, and we try and keep it relevant to what you're going to see and how you're going to handle things in general practice. So that's the My Skin Consult website. That's the teaching methods that we use. As I say, there's an introductory meeting at the John Flynn to start the course off over a weekend, where I'll go over aspects of the website, how to take photographs. We'll also go over the main mnemonics we're going to use, and I'll give you a series of lectures, some of which are interactive, that will give you that introduction you need before you get into the actual website itself. I think you'll, exams. There's an exam at the end of semester 1, and there's one at the end of semester 2. The exams are in fact online. They're done live. You need to, I think you'd need a password to actually get in here, so I won't open it. But what happens is we do one of these over about an hour, 20 minutes at the end of semester 1 one evening. We do another one at the end of semester 2. They're a mixture of MCQ questions and cases, much as I showed you there, are the cases that you do at the end of each module. And the comments come into me, and I then mark them. So most people do well in the exam. We do have some people failing, but they genuinely deserve to fail in the sense that they haven't done the work. If you do the work and you're being assessed each module, you won't have any trouble passing the exams. So I hope I've given you an adequate introduction to the course and to the websites and the teaching methods that we use. And I hope we can encourage you to join us for next year's module. Now, we'll be starting the diploma course in February of 2011. I think the meeting will be at the John Flynn on the 5th and 6th of February. So if you're interested, then basically subscribe, get in touch, and we'll log you into the course for next year, and I look forward to meeting you. Thank you very much. Bye-bye.